Less is more. Do you know the latest guidelines saying regarding the use of sterile gowns for the single source spinal anesthesia? It recommends in uncomplicated adult patients that is immunocompetent or for whom the procedure is expected to be neither difficult nor prolonged, there is, it is not mandatory to use the gown. And the practice of meticulous skin decontamination for the clinician and the patient should be considered mandatory. And for the clinician, this should include the surgical scrubbing up to the elbow, and a head covering, sterile gloves, sterile drapes, and a fresh surgical mask should be considered mandatory in all the cases. And sterile gown usage should be encouraged in the early stages of anesthetic training while experience in performing the technique is being established. In cases where a sterile gown is preferred, a reusable gown should be preferred as a first choice because they encourage to inform the safe, evidence aligned, and environmentally responsible anesthetic practice. And uh, it no longer mandates the routine use of sterile gown for spinal anesthesia unless the anesthetist anticipate a technically difficult or a prolonged spinal procedure or in undergoing a training. Regarding the hand hygiene, they said that surgical scrubbing or rubbing should take at least 2 minutes to complete, and the incidence of colonization was lowest in the group that used alcohol gel only up to the elbows. There are no studies evaluating the role of head coverings in the neuraxial anesthesia. Coming to the face mask, the iatrogenic bacterial meningitis following spinal anesthesia is most commonly caused by the streptococci, particularly Streptococcus salivarius. Transmission from the mouth or the upper airway of the anesthetist or the assistant is the most likely origin of the organism. So it is important that the surgical face masks type 2 or 2R covering the nose and extending to cover the mouth and chin are important when undertaking the spinal anesthesia.